Welcome and thank you for attending our panel discussion. This webinar is being recorded and the video will be posted to the Kellogg Institute website at a later date. All participant screens and microphones have been muted. We encourage participants to submit questions to the panelists throughout the discussion. You will find the option to submit a question in the lower portion of your Zoom window. While we understand that this topic could never be completely covered in a one-hour webinar, our panelists will try to answer as many questions as possible in the time we have today.
Welcome, everybody. This is Paolo Carrozza, Director of the Kellogg Institute. I just wanted to say how pleased I am that so many of you have come to join us today for this terrific collection of scholars from the university and from the Kellogg Institute to talk about a topic that, of course, couldn't be more timely, connecting the core theme of the Institute as it has existed for nearly 40 years now with the most pressing topic of our day-to-day life for the last months and into the foreseeable future. One that has had an impact on democracy and that has revealed much of the strengths and challenges of different democracies around the world in so many ways. So it's really fitting that our first substantive event of the year should take up this theme and explore it on a global basis. So with my thanks to all of the panelists who agreed to be here and help us think about this, this problem today, I want to turn it over to Diane Pinderhughes with my gratitude to her for moderating today. Welcome, Diane, and thank you.
Thank you, Paulo. And thank all of you, all 165 and counting, for joining us today for this important panel. As we reach the end of our spring 2020 semester and the democratization cluster, which is sponsoring this, along with Kellogg, sought to renew its research support from the Kellogg Institute, Samuel Valenzuela, Anibal Perez Linon, and I, and some of the other members thought about focusing on the novel coronavirus, COVID-19, as one of our research topics. We have therefore begun with this first panel, Democracies in the COVID-19 Crisis. We plan to have a second panel later in the semester covering new developments and perhaps other regions. I'll say more about that at the end. My introduction will be very brief since we have just an hour for the event. Our goal today is to gain some understanding of the variations in national responses, specifically how democracies have responded to COVID-19. Our panelists will help us begin to understand how democracies are reacting and how they function in times of extreme crisis. Our panelists today include Jeff Harden, Sarah Niedvisky. We were to practice that and I forgot to ask Sarah how to do that. Susan Shepler and Samuel Valenzuela. Samuel's a little late, but we expect that he'll be here eventually. So in more detail, Jeff Harden, my colleague in political science, is the Andrew J. McKenna Family Associate Professor of Political Science. He's also concurrent Associate Professor of Applied and Computational Mathematics and Statistics. Sarah Niedvisky is Assistant Professor of Politics at the University of California, Santa Cruz. We're delighted she came all the way from Santa Cruz to South Bend. It's lovely now. It won't be for the rest of the winter, but anyway. She's a visiting fellow at the Kellogg Institute for International Studies. Susan Shepler is Associate Professor at the School of International Service of the American University. She is also a visiting fellow for the Kellogg Institute for International Studies this year. And Samuel Valenzuela is a professor of sociology. He's a Kellogg faculty fellow. He is a scholar of Chile and compares cases in the Americas and Western Europe. So thanks to all of you for taking on the task of helping us gain an understanding of the variations and responses to the coronavirus across the world. And welcome Susan and Sarah, as you've just joined us at the Kellogg Institute as visiting fellows. So I'm going to assume that we'll move in the direction of alphabetical order with Jeff Harden beginning his presentation. Thank you.
Okay, thank you, Diane, very much. And thank you to everyone who's here. What I'm going to talk about for a few minutes today is some work that I've been doing for a number of years that we very quickly pivoted to being work on COVID-19 in the last couple of months. And I have some slides. Is there someone who's going to put those up? Excellent. Okay, so I'm, as Diane said, I'm in the political science department here at Notre Dame, and I study American politics. And within American politics, I study state politics. There is a saying from a Supreme Court Justice long ago, Louis Brandeis, who said that the states are laboratories of democracy. And that's kind of the foundational justification for all of us who study state politics, that we have these 50 states in the same federal system. And so that federal system controls for a lot of variables, but then there's interesting and unique variation among the 50 states that we can leverage to learn about all sorts of questions. And one of those research areas, one question that I'm interested in and have been for quite some time, is policy diffusion. That is how and why policies start in one state and then move to another state or move to many other states. And in particular, in work that I've done with some collaborators, I'm interested in what networks define the relationships between states when we think about policies in general, any kind of policy, but also specific policy areas. So are there leaders and follower states in, say, education policy or health policy? So I need to very quickly summarize that work, and then I'll move it into the COVID-19 pandemic. And I should mention that this is collaborative work with Fred Bemke, who's at the University of Iowa, and Bruce Damaris, who's at Penn State. Okay, next slide, please. So when we think about diffusion, we typically think about contiguity, that is the neighbor network. And that's what I've got on this image here. We've got the network of all states drawn according to who is neighbors with whom. And this got us so far in the study of diffusion at the state level, but it turns out that the neighbor network really only tells us about 20% of the policy choices that states make in relation to other states. There's a lot more detail going on in terms of the choices they make about who to follow. Next slide, please. So in our previous work, we've taken tools from computer science and adapted them and developed them so that they work for social scientists to estimate a network like you're looking at here. And we can estimate this network in a static way, so just using every single policy that we can feed into it, or in a dynamic way, so we could have this network change from year to year. And as you can see, it's kind of a big mess, but that reflects the added complexity that is actually happening. That diffusion actually occurs among neighbors as well as non-neighbors. And it's maybe a little harder to tell, but the state abbreviation text is larger for some states and smaller for others. And that indicates their centrality in the network. How important is a particular state in relative to others? And so this technology is referred to as NetInf, which is short for network inference. Next slide, please. The key input, what we need in order to draw that picture that you saw on the last slide, is data on the timings of states' adoption decisions for a policy. And so the example that I've got in front of you here is right to die policies, which diffused to a handful of states, starting with New Jersey in the 70s and 80s. So in our first paper, actually in the paper that I used to draw the picture from the last slide, we had 187 policies that we fed into this algorithm. We've been working to collect more and more data, and now we are at over 700 policies. And this allows us to estimate networks over all policies, but also specific policy areas. Now, the problem with this kind of input is that it takes a lot of time. You either have to go way back in time. In fact, some of our policies start in the late 1700s, or I guess you have to be really, really patient. The point is, the study of policy diffusion requires a lot of data, and the data generating process just takes time to unfold. Right? This is measured in the scale of years. So that brings us to COVID-19. Next slide, please. This past spring, we saw a massive amount of policy activity from state governments to respond to the pandemic. And so Fred and Bruce and I, my collaborators, saw this as an opportunity to study this policy diffusion process in fast forward. In other words, to get a very rapid look at this process that usually takes years and years. So we got a grant from the National Science Foundation and immediately started collecting data on the universe of policies enacted by state governments in response to COVID-19. And what we're doing is scraping content off of the web and coding and cataloging a description of the policy, and importantly, the timing of the policy. And in doing this, we're getting both enactments, so when the policy goes into effect, but also rollbacks, such as if a state reopens some portion of its economy. And right now we're at about 174 unique policies. Some of them are adopted by many states. Some of them are adopted by maybe only one or two. I expect that we'll go over 200 policies by the time we're done. But this is an ongoing thing right now as we speak. Undergraduates at Notre Dame, as well as Iowa and Penn State, are all working to both gather this information as well as collect it and code it. Next slide, please. Now, a very common source of data for us is executive orders. As you can imagine, this is the kind of thing that if you're working rapidly to address a crisis, an executive order is going to be a lot quicker than getting something through the legislature. Although some of this does come from the legislature, and even some of it is bureaucratic level decision making. But here's just one example of a PDF of an executive order from the state of Florida. This is the kind of file that we are scraping off of the web, and then our research assistants are coding for the relevant content that we need. Again, the description of the policy, as well as the timing. When was it enacted? When did it go into effect? And then if it's applicable, when did it get rolled back? Okay, next slide. Just to give you a couple of examples, this is the first 10 or so, or at least 10 from the first part of our 174 policies. And what distinguishes our data from data that you may have already seen advertised on social media or somewhere else is this idea that we're getting the universe of policies. We're not just getting the big ones, you know, the school closures or the restaurant closures. We're getting every single policy that someone in state government thought might be a good idea to enact. And that'll allow us to look at which ideas traveled to many states or which ones stayed local or didn't get widely adopted. Next slide, please. So we plan to make these data public as soon as we can. And we think there's many potential uses with them, as I've got listed a few things here. Things like understanding the factors that lead states to adopt certain policies. That's kind of a traditional diffusion study. We plan to do our network inference methodology that I talked about previously. And also we could do policy evaluation with these data. We could connect these data to case or diagnostic data or mobility data to understand what policies work and what policies don't, what policies are redundant. So as you can tell, this is a work in progress. We hope to have the data posted later this year, but that is what I'm working on right now. Thank you.
All right, I think we will next turn to Sarah Nedvitsky.
Okay, thank you everyone for the invitation and Diane for chairing. I'll be sharing with you today different policy responses to COVID in Latin America's three biggest federal countries, Argentina, Brazil, and Mexico. And this is based on co-authored work with Agustina Giraudi and Jennifer Pribble. With more than 6 million cases, Latin America today is the most affected region in the world. And COVID lands in Latin America in a context in which a majority of the population work in the informal sector. What this means is that these people cannot collect unemployment, contributory unemployment insurance. And this also means that any shelter-in-place order needs to be accompanied by an income replacement policy. In other words, the governments can't expect people to stay at home if that means that these people will not be able to feed their families. And that is the reality of the majority of Latin Americans today. If they stay at home, they fall into poverty. So in this context, governments have reacted very differently. These three countries have tried to expand their healthcare capacity by expanding the amount of hospital beds, by expanding their capacity for testing. But today, let me just focus on the response of these governments with regard to lockdowns or quarantines and income replacement policies. And the goal is to try to explain why three governments react so very differently to a similar pandemic, the same pandemic. So Argentina from the beginning offered the most rapid and comprehensive response. The government quickly ordered complete confinement of the population to make sure that people are not wandering the streets. And this is controlled by the police. So non-compliance is prosecuted as a criminal offense. And throughout the country, schools, public events, and interregional public transport are all prohibited. This country also offered a relatively generous social policy response, a monthly transfer of around $150 since April for households that live from informal activities, and increases in the main conditional cash transfer program, Asignación Universal por Hijo. Brazil is perhaps the most infamous of all the cases. We know that there's no national quarantine or lockdown, so most states have responded with some sort of confinement measures. But the opposition in Congress, the Workers' Party opposition in Congress, has passed a relatively generous income replacement package that includes informal workers of around $120 per month and increases in the amount of the main conditional cash transfer program, Bolsa Familia, and also inclusion of up to 1 million people to this program. Mexico has offered the least comprehensive response of the three countries when we combine these two policy areas. There's no national mandatory lockdown similar to that of Argentina. But slowly, as the number of infected people have increased, Mexico tightened the restrictions even initially by suspending some non-essential activities. But states and municipalities in Mexico have leeway in interpreting what this means. This country also implemented a meager income replacement policy in amount and coverage, as it only originally reached the elderly and the disabled. Now onto the explanation, which is, I think, the most interesting part. Why do we see these differences? The usual suspects in political science, or at least the most obvious ones, are three. The first one is democracy, and the argument would go that the more authoritarian the government, the more it could implement a nationwide lockdown. And mostly democratic countries would be more interested in implementing general social policies. But in this case, and we can talk more about this in the questions and answers, regime type is not it, because all three countries at a minimum are democratic. Fernández, Bolsonaro, and AMLO, the presidents of Argentina, Brazil, and Mexico, respectively, access power through majority votes in clean elections. We can talk more about this. But then ideology would be the second suspect. And so the left, we could argue that the left cares more about the informal sector, and therefore they would implement general social policy. However, Mexico's AMLO is left wing, and he has offered the least comprehensive response in terms of social policy. Informality could be another important factor. How could you implement national lockdowns when a majority of the population will lose their income? However, Argentina and Brazil have similar levels of informality, around 45 to 48% of the population working in the informal sector, of the working age population, and their responses have been very different in terms of mandatory national lockdowns. The main argument advanced by the media has been about the characteristics of the president. If the president recognizes scientific facts and supports ambitious measures to fight the pandemic, and its economic consequences, then the policies will be more comprehensive. And there is no doubt that this is a central factor, whether we encounter responsible leaders that recognize science or whether they are populist deniers. But the idea in this short piece was to move beyond the individual characteristics of the presidents and try to understand the institutional factors that can be generalized to other countries. So in this short piece published by the Americas Quarterly, we advanced three arguments. The first one has to do with the rootedness of political parties. Rooted parties have been around for a long time. Voters have strong party identity, and they tend to always vote for the same political party. Argentina's Peronist Party has a long-lasting identity and has been able to maintain support among low-income voters. So this gives the Peronist president leeway to enact a nationwide lockdown in spite of its economic costs. Bolsonaro, on the other hand, has changed parties 9 times. He campaigned on an anti-party platform, and the vote of low-income voters is disputed with the Workers' Party in the opposition. This means that the president does not have the clear support of the sector that will be most affected by lockdowns. And finally, AMLO's party in Mexico is newer than the Peronist Party, and the vote of the most vulnerable sector is disputed between Morena, his party, the PRD, and the PRI. The second argument has to do with the fiscal power of governors, which helps us understand why some lockdowns are uniform, like in Argentina, where governors have to ask for permission if they want to lift lockdown measures, versus whether they exhibit great variation across the territory, like in Brazil and Mexico, where governors have implemented their own lockdown measures. All 3 countries are federal and decentralized countries, right? But we use the RAI, and we can talk more about the RAI in the Q&A, and find that Argentine governors and also mayors are fiscally weaker than their counterparts in Brazil and Mexico. What this means is that presidents in Argentina are more powerful, and they can exert more command over subnational governments, and therefore induce governors to act in a certain way. And finally, the legacies of a strong welfare state. This variable, we think, helps us understand why the social policy packages are more generous in Argentina and Brazil compared with Mexico. Argentina, Brazil, but also Chile, Uruguay, and Costa Rica exhibit the strongest social policy regimes in the region, so they can build on an already existing generous social programs that allow them to expand very quickly in response to COVID. Mexico doesn't have that level of development of the welfare state, and therefore the response has been more limited. And importantly, these policy legacies are supported by powerful actors such as unions and social movements. So failing to expand social policies in countries with more developed welfare states like Argentina and Brazil would generate a strong opposition from these organized forces. So overall, President's views, interests, and decisions have been decisive for Argentina, Brazil, and Mexico's response to COVID-19. I think that an institutional analysis that considers parties, the power of governors, and the welfare states is also critical to understand how and why the reactions to a common challenge has been so different in these 3 countries. And of course, this all matters because the policy response can have a direct influence on the number of cases and the number of deaths that these countries are facing today.
Okay, thank you very much, Sari. We'll turn now to Susan Shepler, and Samuel has joined us. We'll come with him after Susan finishes her presentation. Thank you.
Great, thank you very much. Thank you to the organizers. Thank you to everyone who's here today. I'm not presenting a piece of research as the previous speakers did. Rather, I'm giving some thoughts and observations about what I've seen in especially the parts of Africa that I've been working in. So this is maybe a little bit more informal, but I'm focusing on the African continent. And for context, I don't know if you remember the map that Sari showed, Africa has actually been one of the least affected by the COVID pandemic, despite early dire predictions about how it would sweep across the continent. The African CDC reports 1.2 million cases and about 30,000 deaths, but that's out of a population of 1.2 billion. So that's only about 1 case per 1,000 people. And the vast majority of those are in South Africa. This is in contrast to the US, for example, with over 6 million cases out of a population of 330 million, which is about 1 case per 55 people. So there are many theories for why this is so, i.e. why Africa has been so little affected. One is that they have a younger population. Demographically, it's the youngest continent. There have been some interesting scientific studies recently that show that many Africans already have antibodies to earlier coronaviruses. So there may have been a similar virus that's already passed through the population. But I think more likely is that weak health systems across Africa probably mean poor reporting. So people are probably not getting tested. And in general, often people will die without going to the hospital, without having their deaths recorded. So corona numbers are likely much higher than those that are officially reported. But we're here to talk about politics. I am an anthropologist, and so I'm not used to doing these cross-country comparisons that the previous two speakers did, but I'll try and do a little bit of that by the end. Rather, I think I'm going to do more of a deep dive into the case that I know the best, which is Sierra Leone, and then talk briefly about Tanzania based on work that one of my American University colleagues has been doing. So starting off in Sierra Leone, I was actually there all last academic year and was there as COVID was ramping up around the world. As you know, Sierra Leone dealt with the Ebola outbreak just a few years ago. So when Corona started, people were ready for it. They very quickly set up hand washing stations outside of businesses, for example. They knew to stop shaking hands. There were already systems in place that had been used during the Ebola outbreak that could very easily be sort of brought back online for the Corona pandemic. And in fact, as an anthropologist, the COVID crisis elicited some Ebola stories that I hadn't heard before from friends and colleagues. It was an interesting moment to reflect on kind of crisis after crisis in Sierra Leone. So President Marabio declared a national state of emergency before there was even one case of Ebola in the country. And so that meant that schools were closed, curfews were imposed, interdistrict travel was restricted. There were some 3-day countrywide lockdowns in preparation, and all of this was before anyone was sick. Now, they did have a weak health system, and so the thought was if Corona came, they wouldn't be able to respond to it. At the time, there was one ventilator in the whole country. The kind of policies that Sari was talking about, like cash transfers, really were not possible for this weak state. So the opposition party had been empowered during the Ebola crisis. And so people were initially relieved when the current president called on Paulo Bangura, who was the former general who'd run the national Ebola response previously, to come to State House to consult. People thought, oh, this is wonderful. He's not going to politicize this issue. He's reaching across party lines to try to get some expertise. But then sadly, what happened is Paulo Bangura and his bodyguard were jailed and accused of bringing firearms into the State House. So this was the first sort of obvious state crackdown on opposition members. Soon after, several other vocal members of opposition were jailed. And then 7 were killed in a mysterious prison riot and fire, where we're not exactly sure what happened even now. So another COVID-related event to add to this theme of crackdown on opposition, because electricity provision is very weak in the country, the government sent some operatives to the heart of opposition territory, the city of Makeni, to take a surplus generator from the district headquarters and move it to the airport to support expanded testing and screening services. When the youth of Makeni heard about this, they got out into the streets, protested, and the police responded by shooting indiscriminately, killing 5 young men and taking over 50 to prison in Freetown. So the people of Makeni responded to this with further protests and by printing Makeni Lives Matter t-shirts and staging protests as well. So for many Sierra Leoneans, the COVID has been an excuse for a militarized repression of the opposition and a way for an excuse really for an authoritarian regime to target its opponents. As of today, Sierra Leone has had about 2,000 cases and 70 deaths. And when I talk to friends and colleagues in Sierra Leone, first they say, why did you leave? It's safer here than it is in America. But they often tell me that the politics is a lot more worrying to them than the coronavirus. So although there's an order in place to wear masks, most people are not wearing them. Even government officials, when I see them online, have the mask pulled down around their chins. And a key issue during the Ebola crisis was citizens' lack of trust of the state. So this relates to our theme of COVID and democracy. So people didn't trust the state initially, so they didn't follow Ebola prescriptions. And I've argued elsewhere that they had good reason not to trust the state. But as I said, when COVID started in Sierra Leone, people, because of the Ebola experience, were ready to believe and ready to act. And yet, in a webinar just a couple of days ago that I attended, it turns out that a lot of the community outreach workers are saying that the result of a combination of low case numbers and President Bio's early and extreme action is creating a renewed distrust in the state and a growing belief now that coronavirus is not real, or Sierra Leonean coronavirus is different than American coronavirus, for example. And so, in summary, the Sierra Leone case is one of squandering political goodwill and to press an authoritarian agenda. So quickly, I see I only have 1 minute. The next case I want to address is on the other side of the continent, Tanzania. And what I'm talking about today comes from the work of my American University colleague, Nina Yamanis, and her co-authors, who've been interviewing district health workers in Tanzania over the last few months. So very quickly, the Tanzania case, when Corona started, they put all the usual policies in place. This was in March. But by May, the president was declaring that Corona was finished, that they had stopped Corona, despite the fact that it didn't seem to be the case. And you may have heard the story of him saying that he gave some tests to the testing people and used samples from a goat, a sheep, a papaya, and then got those samples back as positive. So he claimed these tests are fake, fake news. In fact, we can treat Corona with local cures. And so the director of the Africa CDC has been very worried about this. And in fact, Tanzania has not disclosed any information for months, hindering the agency's ability to help coordinate and guide the continent's response in the pandemic. So my colleague and her authors wanted to take on this representation of Tanzania as kind of wacko, and found that in their interviews, despite the president's declaration, many health workers were still sort of underground doing sort of sensitization work, going around and doing contact tracing, learning from what they had done in the past around cholera and TB. And so despite a limited national policy response, inside Tanzania, some of the workers were actually creating their own guidelines, manufacturing their own resources. And so this suggests that local officials in Tanzania had room to maneuver, even in the absence of truly devolved power. So now very quickly, a conclusion. I know I'm out of time.
Okay, thank you.
Thank you. We shouldn't be speculating. Well, all right, basically, different regimes are responding to the pandemic differently. Some are exaggerating the threat, and some are downplaying the threat. Some respond with abuse of emergency powers, while others are lying to their people. And with a few exceptions, it's not always obvious which states will react how. Rwanda, for example, I think was obvious because they've long touted their technocratic rule, their authoritarian, and they were able to put in place very strong science-based accountability mechanisms. I wanted to talk about Sari's points and how they work in Africa.
Yes.
So maybe we can do that in the question and answer.
Yeah, we need to have time for the questions. So thank you very much, Susan. All right. So next I'm going to call on Samuel Valenzuela. Wonderful. Thank you.
So I'm going to share my screen. the question basically is whether democracies or authoritarian regimes can handle the COVID crisis better. And I submit that democracies can do so better because they can also have all of the lockdowns, all of the quarantines, all the demands that everybody wear a mask and so on, that help cut the transmission of the virus. But they do so in a context that does not close the democratic debate. So journalists are able to ask very poignant questions. The government still has to deal with a Congress to pass its laws, its measures. And the press continues to be very lively. And all of this actually helps fine-tune the measures that democracies take. But there's one condition, and that is that democracies need to have a coming together of all of the forces, political forces that are represented in the country, all of them to go on the same page, believing in the necessity of the epidemiological measures and contributing to their success. So I'm discussing Chile, and Chile was a country that was in the midst of a huge number of protests when the COVID began. In January, the Chilean state, the authorities, the health authorities began to stock up on ventilators, on PPE, on masks, and all kinds of equipment, including the reagents to make the PCR tests work following the World Health Organization kit. They also hastened the building of new hospitals. They rebuilt provisional wards to house COVID patients if need be. They even began a program to make ventilators in Chile, and they succeeded in doing about 100. So they took all the appropriate measures in preparation, and then they issued lockdowns, quarantines, curfews, and people had to ask the virtual police through a website for permission to go out to buy. That permission was only given for an hour, 2 hours a week, that sort of thing. And the authorities monitored every single commune, and a website also allowed you to see what the level of contamination was in every square kilometer of the country. So all of this was very strict, and it did produce the necessary result. As you can see here, the number of cases in the Santiago metropolitan region, population 8.5 million, went really up and down, sort of like did New York. The number of tests for COVID were similar to the European levels, that is, of the medium countries, higher than Sweden, higher than France. Now these tests were done in order to find asymptomatic cases. And so they went to fairs, street fairs with vegetable markets and so on, and they would select at random or ask for volunteers for these tests. And anybody that tested on positive on a rapid test would then get a PCR. And the PCR turnover rate was 2 days at most. So this is the evolution of the positivity rate of the PCR tests. It went down to less than 5 in the Santiago metropolitan area. So that meant that the country was able to begin to open up. This is the case fatality ratio in Chile. So that means that the mortality rate from COVID was extremely low, lower than the countries you see on the table. And then there were all these measures in order to give income support to people. So people who were very poor got direct transfers from the state of about $170 per person up to number 4 in the household, and then less subsequently on a PPP exchange rate basis. People who were private consultants got payments equal to several months of their past earnings. There were payments for business leaders, for small businessmen, for unemployed workers by supporting unemployment, extending it. And also, the parliament demanded that the constitution be changed so that people could withdraw 10% out of their individual retirement accounts. And this is a line that you see here of people who had forgotten their usernames or passwords and so on, so that they had to line up to get their 10%. Well, all of this has put in $76 billion dollars into the economy on an exchange rate basis, plus about 15 billion to these people who got their retirement accounts. Now, all of this has occurred without an interruption in some demonstrations when this measure was being discussed in Parliament, demonstrations by people banging pots and pans in support of the measure. The president didn't want it, but he was forced to sign it because the Parliament passed it. And then he said, okay, I agree with it. Now they also were supposed to do a plebiscite in March over changing the Constitution. By agreement among all the people in politics, they postponed that until October. And now the campaign for that plebiscite has already begun. Over all this period, the questions of the journalists have been very poignant. The press has been very free in the discussion of all of the measures that were being taken. So the democracy has not been interrupted, and I submit, for reasons that I don't have any more time to explain, that the measures taken by the government to confront the crisis have been perfected and fine-tuned, given these very forceful debates. Thank you.
Thank you. Thank you very much. We are now turning to our questions, and we have some that have been submitted before the panel. There'll be some that we're going to address, although we have only limited amounts of time, from the live audience that's with us. There's a question about science, medicine, and power that Susan said she would consider. This question is, what were the strategies to contain and prevent SARS COVID-2 in Sweden and the United States? What has worked and what has not worked to limit spread in these countries? And Susan said she could talk about a project that you're involved in. No?
Pass.
Oh, okay. All right. So let's see. I'll just read some of these questions then. So instability in governance seems to be a common theme in the wake of COVID-19, from Belarus to Mali to Lebanon to Thailand. We've seen that as the case in Sierra Leone and Tanzania. Chile is a little bit different in that there was instability before the COVID, but at the same time, as you suggested, there's been a lot of movement of various policies that worked well. So, and of course, Jeff is doing work on what states are doing in the United States. I don't know if you can make general statements. So this question, I'll just throw it out. What kind of issues do you want to talk about in terms of the overall question about instability and governance? No one's going to talk.
Well, the problem of instability in governments, especially democratic governments, comes when the COVID becomes an issue of debate over different politicians with different groups, political groups that don't agree on the policies. So that's the advantage of democracies. But the advantage of democracies is that everybody can come together and all speak on the same tune and then affect the policies. But if that doesn't happen, then democracies become very, very messy. And the Chilean situation is also had the advantage that it's a unitary government, and the national government can direct its policies to specific areas of the country without worrying about what a local governor thinks or a local mayor thinks, right? Nonetheless, they receive the input, right? There's an open discussion, so they get the input. But having a federal state makes all of this process much more difficult. And for instance, that's why one should contrast Germany and the US, right? Because in Germany, things have worked because Angela Merkel was able to put everybody together on the same page, the local governors. That hasn't happened in the US. In Brazil, all of this is a complete mess because the center of the country doesn't believe in the epidemiological measures. In Mexico, they do believe, but I don't know, that I never thought that Mexican state was all that strong.
Sarah, did you want to respond, given your focus on South American countries, also Mexico, Brazil, Argentina?
Yeah, if it's okay, can I answer the two questions that were posed in the chat by Tomas?
Sure, please.
So Tomas Gold asks about whether today Argentina can be actually considered a success with the amount of cases increasing so rapidly. And it is among the countries, if we look at the indicators in the New York Times, where the deaths as a proportion of the population are increasing the fastest in the world. And so I think that the Argentine case, I have to say I'm also from Argentina, so I've been following the news very closely. My entire family and most of my friends live there. I think that the case of Argentina shows the difficulty in sustaining long-term lockdowns, right? At the beginning, it was the correct measure, and hopefully the government used it this time to expand health capacities, as many were talking in their previous presentations, use it to expand their capacity to have hospital beds, to have respirators, and so on. We wrote the paper with Agustina Giraudi and Jennifer Pribble back in April. We wrote it from this position of what is political science? What are we as political scientists doing in this context? What is our role, right? If not to try to explain these initial responses. And so I think that if we were to write this paper, this short piece again, we will for sure have to incorporate other dependent variables and not just lockdowns and social policy measures. But in spite of that, I think that the initial response of the government still matters, and still matter for buying the government that time in order to be able to expand health capacities. And when we compare still today Argentina to Mexico and Brazil, the number of deaths as a proportion of the population are significantly lower. Even if today people are on the streets opposing the lockdowns, there's a lot of conflict inside the country. And then going to David Smiley's question about when you look at these three cases, the most obvious reason is populism, right? Bolsonaro and AMLO are populist leaders, right? They way of governing that is very different from that of Alberto Fernandez in Argentina, for example. And I think that populism definitely has something to do with this, and being a populist denier doesn't contribute to a comprehensive response towards COVID, and the US is also a case of that. At the same time, responsible leaders don't seem to be doing much better, right? I mean, populist leaders are doing really poorly, But then there are very responsible leaders like Martin Vizcarra in Peru, who implemented all of the right policies, and still Peru is one of the worst cases in Latin America. And in part that has to do with more structural contextual factors, with, in the case of Peru, clearly no legacies in terms of social policies, income replacement policies, a health system that is devastated even before the COVID starts, right? And so it is true that populism has something to do, but it is not obvious that non-populists are doing better.
Okay, thank you. I don't know if there are some questions that Jeff or Samuel or Susan want to respond to.
It looks like Professor Kopich has one for me, so I'm happy to.
Okay, good. Thank you.
Michael Kopich asked, do you also analyze the influence of CDC recommendations on state policies? And so the answer to that is we have not collected information from the CDC website, although it may be useful to do that. I guess from our perspective, that's one of those variables that gets held constant by looking only at the United States and the states within the country. We are collecting information from the state departments of public health, and so we can look at variation from state to state in terms of recommendations that state public departments of public health are making. But in order to look at CDC compared to what states are doing, you would have to augment what we're currently doing.
Okay. We're getting close to the time we're supposed to end, but I'm going to see what kinds of, Susan, there is one comment about your number 14 person who says, I also expect the impact of the COVID to poor countries with poor healthcare facilities may be smaller, such as African countries. My conjecture is because of the poor healthcare conditions, the COVID is not as much a threat as in wealthy countries. And you've actually said this, the demographic condition could be a reason.
Yes, I agree.
Mm-hmm.
And a lot of people are dying for other simpler reasons before COVID even comes around.
And actually, that is something the person does suggest. Samuel, do you have any observations? Let's see.
I was answering Anibal's question, and
Yes.
the federal states, I think, cannot adequately control their borders as fully as unitary states can, control the whole territory. So you can always drive in, right, from outside. And but the most important thing is that if federal states don't have a national leader who forcefully creates the environment for all of the states to put inputs into the policy and coordinate the whole thing, then the whole country response doesn't really work very well. And this is what the German situation suggests.
With Angela Merkel being a much better
coordinator
and leader, yeah.
Of the whole thing.
And a scientist, a person who believes in science.
Right.
Sorry.
Yeah. Absolutely. Yeah. You don't have to be a scientist to be in epidemiological science, but it helps.
Yeah, yeah.
And maybe if I can add just one thing to that question that Aníbal posed, I agree completely with Professor Valenzuela, and also the effect of federalism, I think, has to do exactly with what Aníbal is saying, what the national policy is too, right? So federalism or high decentralization produces unequal responses throughout the territory, as we are talking. But thank goodness for federalism in countries like the US, as Jeff was presenting, or in Brazil or in Mexico, right? So in countries where national leaders are not responding positively or in a way, thank goodness that we have states like Sao Paulo or even Rio de Janeiro responding with stringent lockdown measures than the national government did.
But that doesn't eliminate the COVID crisis,
Right.
because
Yeah.
it just pops up in other parts, and then it boomerangs back.
Absolutely.
So let me see. There's one other comment that just appeared for Samuel. How do you expect the public opinion surrounding the government's response to the pandemic to affect the vote on the new constitution in October?
Well, there has been a huge turnaround. The parties of the right are now in favor, most leaders of the parties of the right are now in favor of changing the Constitution and doing it by a constitutional convention. They're aiming that they're going to get a nice representation in the Constitutional Convention anyway, so what? They've also backtracked completely from their support of the AFP capitalization system for the pension. Now they're supporting a universal minimum pension for everybody, and then, you know, a supplement, which would be the AFP kind of model, basically like we have in the US with the Social Security plus the TA, CREF, or the Vanguard or whatever. And so there have been profound changes in the attitudes of the right and the left, as the rightist politicians have in fact approached more a social democratic posture. It has been surprising to watch.
All right, okay. There was a part of the question that I posed to Susan that I didn't read. And when you were talking about the president of Tanzania, there's some thought that the president, Magufuli of Tanzania, may have declared COVID over because he knew he didn't have the resources to fight it. Do you want to comment on that?
Oh, I actually said that.
Oh, I'm sorry. And
That was me responding to somebody else.
I see.
I mean, I think the African context is so different from the Latin American context, the European context, because there just aren't resources to do so many of the policies that people are talking about.
Mm-hmm.
It's impossible for people to stay at home and work from home, right? And so there's a different set of strategic choices that African leaders have to make with such a small resource base.
Uh-huh. Thank you. Thank you. That's very important. So we're down to just a few minutes. Let me see if there are any closing comments or remarks that you would like to make in light of our efforts to have this first discussion about COVID across the world and across the nation in the case of Jeff's study of states. We know that given the interest that, you know, the audience has shown, and also the fact that COVID is not going away, we will be having a second panel. We'll hopefully be able to use all the aspects of the Zoom a little bit better the next time, at least in my case. Go ahead.
Let me add in response to Susan that there is no Latin American case. There are Latin American cases. There's a profound difference between Bolivia, even Peru, and Chile, right?
Well, the same is true in Africa as well.
Absolutely. And the disparities, nonetheless, between one country and the next and sharing frontiers are, I think, greater in Latin America or in the Americas. So yes, having a solid health care system, having resources, it makes for a strong state. One needs a strong state. It makes for having resources. You can't respond to this crisis without resources. And so that leaves the poorest countries in the world in the worst possible situation. And the lines of globalization are the same lines as the COVID crisis. So countries that are the least globalized are the last to receive it. And when they do, and when it comes basically to the set of poor countries, this is going to be a very serious issue.
Thank you, Samuel. Jeff, I'm looking at you.
Well, I think that, you know, in my case, looking at the U.S., in some ways, the relative lack of a national response gives kind of a blank canvas for states to operate with, and that produces variation. And so that's obviously a benefit of federalism. In the case of the U.S., states have relatively more resources compared to maybe some of the other cases we've been talking about. And certainly not unlimited resources. They need the federal government for a lot of the really big, expensive stuff, but they do have more flexibility. And so that means there's more variation in how they can respond based on preferences of the population or the governor or the legislature.
With a state like California being one with significant numbers of resources and great health care, but at the same time, COVID has shown its ability to resurge even though they started working very early on.
Mm-hmm.
All right, so I'm going to take on my role, and we're at 6:32, and say thank you all for joining us in this new effort at talking about something as complicated as COVID across the country, across the world, and providing both thoughtful, research-based reflections, observations of what's happened in South America, Chile in particular, parts of Africa, the states, and the United States. And we plan to have another one of these. We'll see. We're not sure exactly when that will be at this point, but sometime a bit later in the semester, and hope that we can provide some ability to understand what's happening nationally and internationally. So we really appreciate your willingness to take this on and to participate in this panel. Thank you very much. Good luck. Good night. Goodbye.
Thank you.